हेलो, नमस्कार। मैं डॉक्टर विनीता और आज का अपना टॉपिक है सैम्पलिंग। सैम्पलिंग करने से पहले हम थोड़ा सा सर्वे के बारे में जान लेंगे। एक सर्वे मेथड रहता है। सर्वे यूजुअली यूज क्वेश्चनियर एंड इंटरव्यू एज ए मीन बाय विच इंफॉर्मेशन इज गैदर, बट सिंस ए की कैरेक्टरिस्टिक्स ऑफ द सर्वे इज द large number of people who take part, means they are taking large number of people who are taking part in that survey. It is often quicker and much cheaper because there are people who are doing survey. They are not doing it in on the basis of cost, so it's a cheaper method. People usually participate and they answer the questions. And it's a questionnaire base rather than interview type. So they ask some questions and people have to answer those questions. So they are doing survey. So there are some general principles of surveys. First, general principles of survey. The first stage in design a survey is to establish its aim. So what will be the aim of the survey? They should define it clearly, so that if we are asking about back pain or we are asking about neck pain, so we have to be clear about that what type of neck pain, what type of back pain we are assessing. So here we will go for how many people use it in the course of year. So if a person who having back pain, that how many times or how like duration of that time when he is using tens, where do they come from? So the society, the living area matters. How many men use the clinic? So it's depend upon the gender also. So women men, how many women men they are using the same clinic and the same type of treatment? What are the ethnic origin, what are the age group, what are the occupation? So these are the data which bias our result. So we have to collect it. So we have to emphasize on it. What were the presenting medical problem? How long do user come to treat those problems? How do user rate the quality? So if we are assessing a clinic, we have to analyze these type of questions. So this is a general principle. We have to analyze each and every aspect so that our result didn't bias. The design of the survey, it's two commonly used survey designs are prospective based design and a retrospective design. Prospective design is involve identify the group of people you want to study and then collecting the information you require when they use the particular service. Like if a clinic which is home therapy based, like they people are coming for back pain, neck pain, so what are the particular services they are giving? So they require the general aspect and group of people study. So for example, you might want to focus on patient using a back pain clinic who had no known injury to the back. As soon as such patient enter the clinic, the researcher would collect the relevant information from them. While this approach allow the researcher to select participants according to clearly define the criteria. It can obviously be a very time consuming process to assess an adequate number of suitable participants, because you have to analyze each and every patient. Like patient is coming for knee pain, but you have to first analyze that is patient is coming for back pain or anything. So however, a commonly used survey approach is retrospective design, which focus particularly on the past event. So what happened to the in the past? For example, you might identify from the medical records of the department that there may be a back pain clinic or patient who present with back pain but who had no known injury. You would then contact these patients to collect the information you require, such their subsequent problem and perception of care, etc. So these are the two survey based technique. Then there is selecting the people to take part. So our topic is that how to select a sample. So finding the appropriate number and type of people to take part in your study is called the sampling. So when you are choosing that, like, I have to analyze that how many people are facing back pain due to injury, so you have to go to that clinic and different clinics, and you have to find out that if there is a back pain patient, so they had an injury or they have a back pain due to postural or other thing. So you have to analyze it particularly. So finding the appropriate number and type of people to take part in your study is called the sampling. So sampling is a vast thing, so we will divide it into different parts. Sampling, when selecting a sample, the sample means average people. Like, we are not, if there is a community of 100 people, we are not taking that 100 people, we are taking a sample from that. So average number of people we are taking. Characteristics should be same as the population means, like the area should be same, age group should be same. The main thing is that we are assessing the back pain, so there should be back pain to the patient, because in this way any result from the sample can more confidently be assumed to apply to the population from is drawn. So like, if you are assessing 1000 people and you are taking 100 of the sample, then you are very confident that 100 people having back pain due to injury, and what type of injury they have back pain, so you can analyze a result very clearly for that 1000 of the people, that what are the causes of that injury and what will be the outcome. So sampling is like that, you have to analyze and you have to frame it. So incidental sampling is selecting most easily accessible people from population. Known probability method of collecting sample, undoubtedly an easy way. So it's a easy way to sample or to collect the data. So population, like, if you are if you have a population, like if you are working in your vicinity and you can finally select the people most easily. It's involves selecting people most easily accessible people, like you can approach it easily. Like, if a physiotherapy student, he want to survey or he want to just do a questionnaire method, he can mail to their colleague that how many people are affected by the back pain because of doing home care or home care exercises, because there is a low bed and low floor beds, so they are going to give physiotherapy to the patient, and that time they take back pain. So this is a incidental sampling, where you can easily find the results, you can easily find the population whom you are choosing and collecting the information, and it's a easy way. So there is a quota sampling. In quota sampling, accidental sampling, purposive sampling, and volunteer sampling. So it's depend upon the type, whether you are selecting voluntarily people that they can take part. Like in colleges, people are doing research work and they are voluntarily asking people that if you are voluntarily, or if you are agree to participate in our research, they participate and you are collecting the data. Purposive, like you have a purpose, particular selection, so you are doing that. And accidental, which I explained you, it's a easy method, or you can select. In this approach, you must know what particular characteristics are likely to be important. Random sampling method. Random sampling, also called the probability sampling. Fundamental requirement of randomized control trial. Every number of the target population have equal chance of selection. Like if you are selecting 100 people and you are saying there is a 4 lines of 100 peoples, or 5 lines, or you divide it into 10 lines, you have to select every third person or every second person. So this is a randomized, so everyone have the 100% chance or to coming. So simple random sampling, stratified random sampling. So in this sampling method, the stratified sampling, it involves research defining relevant subgroups of the population. It will be costly, difficult and time consuming, because you have to define each and every subgroups. So there is a group of 100 people and you are divided them into subgroups, and they have a some relevant information. So, in systemic sampling, this involves choosing every third or seventh or whatever number of people, which this is not a truly random technique. It usually provides a sample that is adequately representative of the population. So you have a thousand of the people, and you are selecting in a systemic approach, like you selecting every third person, every second or every seventh person. So there is a chances that people have 100% probability to choose, but the technique is usually provide a sample that is adequately representative of the population. The interval should be decided in advance. If you are selecting a population, you have to just analyze it advance, or you have to say it advance that you are selecting every third person or you are selecting every seventh person, because after dividing into the subgroup, you can't select the people that I am selecting the third person, I am selecting the seventh person. So you have to be very clear so that there is no biasness. There is also a cluster random sampling, which is used when the target population fall into natural cluster that might affect the result of your study if each cluster is not adequately representative. So this is your chance that you are adequately selecting the cluster or not. So the cluster sampling, like for example, you might to be concerned with the conducting a survey of the attitude or all the staff. You are assessing the attitude, so you might be concerned with the conducting a survey of the attitude of all the staff employed by large hospital trust to moving to fundamental hospital status. The target population might fall into the some group like medical staff, nursing staff, or there is professional or allied health or medicines. So domestic staff is there, healthcare assistants are there. So these group also fall into medical and surgical area, inpatient and outpatient provision, clinical specialties. So there is a vast area. To select a cluster sample, you would first need to identify the member of each possible group and then randomly pick your sample from these. So you have to identify that there is a nurse workers, or so you have to analyze in a cluster, and there is a random sample which is very so important advantage over the other sampling technique, in that the sample, because it is more representative of the population, does not have to be very large. So sample size is small, and it's also a cheaper method. However, like first you first there are a major disadvantage. The researcher should theoretically be able to access all the population member, and then only he will do the random sampling. Then we are going to the sample size. So first choose the method of sampling, that which method of sampling you are choosing. It's a randomized control trial or stratified sampling, or you are choosing other sample method. So decide how many people required. Like if you are doing your research, you have to analyze that I am doing on 1000 people, I am doing on 100 people, I am doing on 500 people. So you have to decide the sample size and people you are selecting. So the procedure for calculating appropriate sample size depend on whether an experiment or a survey is being conducted. Big sample reflect reasonable accuracy, because there is a we are collecting from the big population, so we are assessing each and every people. So there is a sample size which is very large. Too small sample, it risk unrepresentative, and sometimes researcher draw accurate conclusion. In a small size, you feel that there is an inaccurate conclusion. So it's clearly important that you have to select the big size, because it should be big enough to reflect with the reasonable accuracy and the views of the population from which it drawn. If the sample is too small, it runs the risk of being unrepresentative, which I already mentioned, and might lead to the researcher to draw inaccurate conclusion. Sorry. In recent personal example illustrate the case perfectly. I had to chair a PhD viva at which there were 4 people present: the candidate, who two external examiner, and there is other one. I went the examiner would lunch of the 4 people at the viva. 3 were left handed. All 3 people at lunch were vegetarian. If I had believed that these two sample were representative and adequate size, I would have come to the conclusion that 75% of the population left-handed and 100% them are vegetarian. So it's depend, like, because the sample size is too small. There is only 4 people and 3 are left-handed and 1 is right-handed. So what is the conclusion? And all are vegetarians. So there is biasness in a show, if the small sample size, if there are people who are taking the TANs, or they get relief from the TANs in 10 days, but the sample size is very short, like 5 people only. So how, if they are very new, like people who are not taking TANs before, and they are coming to your clinic, they get relief very instantly, because they are not used to it, their muscles are relaxed, and maybe they have acute condition, so they all 4 are relaxed. So we can't say that back pain is treated only by the TANs. So there may be other biasness, because you have only 5 patients. If you are taking 10 or 15 patients, there may be a condition with chronic back pain, or there may be a condition in past, they had a back pain with chronic, but now get relief, and secondly they approach you and they are getting treatment from you, so they are not getting better in 10 days. So there is a biasness. So yes, you have to choose your sample very wisely. The next topic we will learn is the hypothesis. So maybe the classes are good, and if you are not understanding anything, or I'm lagging in anything, please comment me, so that I can help you. And yes, it will be good for me to prepare more for you. So I'm giving you examples so that you can easily understand this, because it's a different topic, and but I want that more and more people indulge into it, and I want more people to be interested in research, so that you can read the research, you can apply to your clinics, apply to your patients, because if you understand the research, then only you can read the research papers or articles, and it will be helpful for you when you will treat the patients. You will understand that how the researcher work, and how the therapies work, and how these are working. So my best wishes with you. Please share if you like the videos, and if you gain something from my videos.